Hey Jim, my name is Neil Anderson. I'm a graduate doctoral physical therapy student at Rocky Mountain University. Is Jim the name you prefer to go by?
Yeah, yes.
Okay. I was just looking over your screening form when you're coming in today, and I see that you're mainly coming in for some knee pain.
Mm-hmm.
And is that both knees, mainly right or left?
Left one.
Okay. As we go throughout this, I'm just going to be jotting down some notes of things that we talk about, just so that we can refer back to them
Okay.
throughout our time working together. So that's okay with you. But before we get into your knee stuff, kind of just to get to know each other a little bit better, I always like to ask people, what's your favorite movie?
Sleepless in Seattle.
Okay. Is it pretty boring movie with them just sleeping the whole time, or?
No, it's just, it's one of those chick flicks.
Kind of like You've Got Mail, the classic.
There you go. There you go.
Okay. Well, I myself haven't seen a lot of those movies, or don't remember seeing them as much. I kind of like more of the Fast and Furious type movies and James Bond
There you go.
myself. But for your knee, about how long has it been bothering you that brings you to come in today?
About 6-7 months.
Okay. Are there any specific activities or positions that maybe aggravated or caused more pain?
I think from long years, many years of running.
Okay. And are there any specific activities or positions that maybe bring, that ease the pain?
Just getting up and down from chairs.
Okay. That eases the pain?
Makes it, I notice it more.
Okay. And as far as that pain you have, where is it located more or less?
Just right around here and then comes around the back behind the knee.
Okay, so just kind of on the outside portion and behind, nothing really in the front around the...
A little bit on the front.
Okay. And what type of pain how would you describe it?
Just the achy, dull.
Okay. All right. And on a scale of 0 to 10, 10 being no pain, 10 being the worst you can imagine, what would you rate your pain right now in the knee?
3 to 4.
Okay. And when it's at its worst?
5.
Okay. And at its best?
2.
All right. Does the pain change at all during the day, or does it pretty much stay constant?
Sometimes when I'm doing things I don't notice it, it's less, but then there's times when I think about it more, it's a little bit sore.
Okay. Are there any activities you have difficulty participating in because of it?
No, I can do pretty much anything I want to. Obviously I enjoy walking, and so maybe a little stiff at the beginning, but after I'm moving and going, it's okay. A little
Okay.
sore afterwards.
Do you notice the pain during the walking, or is it kind of just that onset and the afterwards?
Just the onset and afterwards.
Okay. And have you had any other treatments for the knee pain?
Just a cortisone shot
Okay.
about 3 or 4 months ago.
All right. And did that help at all?
It did, yeah, it did. I was rather surprised.
That's good. I used to work in an imaging center where we would do a lot of cortisone shots like that with people, and I noticed that they had a lot of good success with that. So glad to hear that, but I also saw that it doesn't always last forever.
Yep.
And so hopefully we can figure out what's going on so we can get this to kind of dull down a little bit more or go away, more so permanently. Before this last 6 or 7 months, have you ever had problems with the knee before? Any other injuries to it?
No,
Okay. Don't know if I asked this or not, but was it a specific injury that caused this, or just kind of stuff over time?
just gradual over time. My dad had problems with neuropathy and weakness, and as I'm getting older, I'm worried that I'm going to have symptoms like my dad, so I want to prevent those things from occurring. I want to maintain my strength and my balance, and so those are reasons why I'm concerned about it.
Okay. Do you have any pain in your knee when you sit like this, or is it fine?
No, it's fine. It's just that when I cross my leg like this, when I bring it back down, it's a little sore.
Okay. That's good to know. Also, just wanted to know, just in case you're in pain during this interview or whatever, we could have you stand up or move around for a bit. Any medications you're taking?
Baby aspirin?
Okay. Any medications for the knee?
Nope.
All right. You said you had an x-ray on your knee, is that correct?
Yeah.
What were the results of that x-ray?
The spacings were all normal, and they were negative for any degenerative disc joint disease.
Okay. Have you had any other imaging, like a MRI or a CT scan?
No.
Okay. I was looking in your screening form you filled out when you were in the waiting room,
Mm-hmm.
and I saw that you have had some previous surgeries. You said you had a
Mhm.
pacemaker put in,
Yep.
and you had a torn rotator cuff
Mm-hmm.
on the right shoulder.
Yep. And then I had hammer toes on both feet about 2 years ago. Had them straightened out, so
Okay. Any complications with those, or did recovery go well?
yeah, just takes time.
Okay. I also saw in your chart you said that you have a family history of heart disease. Is that
Uh-huh.
correct?
Yeah, my dad had bypass surgery when he was 53, but he passed away close to 86. So just gotta stay active.
Okay. Anything else, or is what you reported before accurate?
Everything's accurate.
Okay. As far as your lifestyle and living, what do you do for an occupation?
Healthcare worker.
Okay. Does your knee affect or limit your ability to do anything with your job?
No, just up and down, standing, sitting, not too much.
Okay. And do you live in a home?
We do, yeah.
Okay. Any stairs in the home?
Mm-hmm.
Does your knee cause any pain with you when you're going up or down stairs?
10-15% of the time, but not bad.
Okay. That's something that we can address and kind of work on when we're doing our therapy. And we can also work on what side of the stairs going up is the railing on in your house.
Left side,
Okay, and is it weight bearing?
yes.
Okay. What do you like to do for fun? What are some like physical activities or hobbies?
Hiking, biking, gardening.
And have any of those, you mentioned, have any of those been limited with your pain? You mentioned kind of the walking onset and afterwards, but
They've been okay.
okay. I also saw in your screening form you said you don't drink or use tobacco.
Mm-hmm.
Is that correct? Besides that, any other like recreational drugs you may take? Nothing? Okay. Before your knee pain came on, what would you say your activity level was before?
High to moderate.
Okay. And how do you feel it is now compared to before? Any?
Just decreased maybe 10%, but pretty much the same.
Okay. All right. I'm just gonna ask you a couple questions just about how you're doing overall.
Mm-hmm.
I saw in your chart you said that you've not really been experiencing anything like nausea, vomiting, chills, sweats, nothing like that.
Mm-hmm.
You just kind of marked that you'd had some pain or something going on with the left arm.
Yeah, I think probably looking at my phone, looking at appointments, which has caused maybe a little bit of some numbness or tingling. Just something to be careful about.
Okay. Just some more questions pertaining to your body as a whole.
Mm-hmm.
Have you, in the last month or so, been experiencing any joint pain, swelling, stiffness?
I feel like my left knee's a little bit more swollen. It feels a little thicker than the right. I notice I can't kneel on it and sit back like I can my right one.
Okay. Any coordination or balance problems?
As I'm getting a little older, I can see that there's some issues by trying to do some balance exercises by standing, and so I'm trying to do some things.
Any vision or hearing problems? Okay. Have you been having any chest pain, shortness of breath, heart palpitations, kind of where you can feel the heart beating?
No.
Okay. Any like rashes or skin changes? Any new moles or sores or?
No.
Okay. From physical therapy in our time together, what would be a couple goals that you would like to achieve, or maybe by the end get to a certain level with something?
Just decrease the soreness in my knee by 10-15% and just improve my balance.
Okay. Okay. I think something we could also do with this to hit those goals, so maybe lower goals, is we could work on maybe getting better. We could look at your range of motion and see if we could improve that there. maybe some also strengthening the muscles around your knee and hip to help with that balance, if you're okay with that. And just to make sure that we're on the same page, I just want to kind of summarize what we've talked about today. So you're a relatively healthy, active adult. You have enjoyed a life of hiking, biking, being outdoors and doing physical activity stuff. About 6 months ago, you started having some pain in your knee. You got a shot in it about 2 or 3 months ago, helped for a while, pain's coming back. And so you're wanting to come in to see if we can do anything to help decrease some of that soreness, pain, improve your balance. And is that good?
Yep.
Anything you'd like to add or clarify?
No, you got it all.
Okay, I think now that we're done with this, I'd like to move into and do an exam where we'll learn a little bit more about what's going on with the knee. We'll be doing things like observing how you move, testing your range of motion, muscle strength, and doing some tests to get us a baseline of your functional levels.
Okay,
Is that okay with you?
it is.
Okay,